Welcome back. I'm Dr. Bill James. Today I introduce a very important part of our mission here at your healthcare system, Spartanburg Regional. Spartanburg Regional's commitment to each of you is driven by one thing: our passion to improve the health of your entire community. This is the core of our mission. We recognize that improving community health is a collaborative effort. To create necessary change, the entire community must work together. Spartanburg Regional is proud to be a partner in a number of meaningful health initiatives. One of our most successful is today's featured community health project known as AccessHealth Spartanburg. If you or your friends or family members have ever fallen on hard times with little or no income and no health insurance, you've likely prayed for someone or some group to step in to remove the barriers, the roadblocks preventing your friend from taking care of her health. AccessHealth Spartanburg was developed to do just that, to connect low-income citizens to a medical home, a system to improve the medical outcomes for patients while reducing the cost to you, the community, which of course means all of you watching today. AccessHealth has enrolled over 860 patients, representing over 700 families, connecting them to services about which they were not aware. And we've made over 10,000 appointments with physician volunteers. Some sick patients can see no way into the system, no access for their health care. They simply wait until everything falls completely apart and then come to the emergency room for crisis care. We're thrilled. In its first year, AccessHealth reduced costs for our enrolled patients by 81%. These were costs for hospital admissions and emergency room visits, the most expensive form of care for all of us. Spartanburg Regional is one of 10 community partners who have come together to create this wonderful project. We pledge to identify and prioritize the most pressing health care problems in your county and then chart a course to improve each one of them. It's exciting to see what can happen when a community works in brotherhood. And Spartanburg Regional is very proud to be a partner in AccessHealth and in our other regional projects. My father, Frank James, managed the local movie theater and served 27 years on City Council, both in his beloved hometown of Union, South Carolina. Simultaneously, he volunteered for every charitable organization willing to have him. He was devoted to one concept: service before self. However, he knew, as we still do, that community services have never been well coordinated and that community partners do not fully understand each other. Happily, those things are now changing. Well, the 40 different agencies of AccessHealth are still proactively learning these same lessons as we together create a community plan of action and put measures in place to monitor our progress. So yes, we are still a work in progress, but we are also a treasured weapon, a weapon in the challenging healthcare future that we all undeniably share. Now, my father would guess that many of you are indeed watching today through eyes powered by the kind heart of a willing volunteer. So I think that he would say to each of you, stay in touch with Spartanburg Regional and with AccessHealth Spartanburg, because you will be proud. And so until next time, thank you again for joining us.